Wanted to talk to you today about the different options available for health insurance. Open enrollment is coming up, and there are going to be lots of things thrown out there. There's going to be a lot of different companies that you may not have heard of that are going to definitely be pushing hard to try to get you covered for January for 2023 before that enrollment window closes. And of course, offering those great deals that sometimes seem a little too good to be true. So just want to kind of clear up some of those and make you kind of ready to ask the right questions so that you're prepared and you're not left scrambling at the end of the year, fighting with a company that may have misrepresented themselves, or unfortunately, being not covered properly in 2023 after that window's closed if you don't have a significant reason for special enrollment, or if you don't qualify for private after that enrollment period closes. So of course, everyone is aware of Obamacare, ACA, the Affordable Care Act. Everyone is eligible, despite what some people think. Whether you think you make too much money, you just pay full price for that premium if you don't qualify for a subsidy. So everyone is eligible, regardless of your income, to pay full price. Depending on your income, you can get those subsidies and tax credits to bring that premium down a little bit to possibly make it a little more affordable, and we can kind of help you with that. To see where you fall and kind of walk you through those options and make sure you're finding the right fit for you. Check your doctors, make sure you're finding the right plan, because once you've selected and that enrollment period is closed, you can't make any new elections going into the new year. Private options. There are a lot of companies that pop up. I always suggest, asking lots of questions. Lots of companies like to throw around no deductible. A lot of times, no deductible means that there is no catastrophic coverage. So making sure that you understand, what happens in the event of something major. A lot of us aren't worried about those day-to-day visits. We're healthy. We're not going to the doctor often, so I'm not worried how many doctor's visits I have. I'm worried about if I'm in a major accident or have a major diagnosis, or heaven forbid, a heart attack or a stroke. What is my end all out of pocket going to look like? That is what the insurance is there for. So we want to know what that looks like. And if you are talking to someone that cannot give you a definitive answer, get off the phone. Find somebody else. Do not sign up. Look up the plan. Ask more questions. Find a different agent. I've talked to several people recently that have signed up for some plans that they've no deductible, and then once they've started doing some digging after they've paid that initial premium and they're waiting on that information to come in, they have realized it does not cover anything. You get some doctor's visits. It doesn't have any real back end coverage for the big things, which is what the insurance is meant to cover. So just beware when that time comes, November 1st, or if you are in a special enrollment period throughout the year, to ask those questions or find someone that you trust, or get a valued referral from a friend that you trust, someone that can walk you through the process. Always happy to help answer any questions I can. That's what we're here for. We want to make sure that you're covered properly so that you know what that end all out of pocket is going to look like in the worst case scenario, because that is what the purpose of insurance is for. It's not necessarily to make sure that every doctor's visit is free or every prescription is free. It is to make sure you are covered in the worst possible case on the worst day of your life. So if we can be of any help, please reach out. Contact information is in the comments.